Good morning, and welcome to the Heartland Childhood Obesity Summit. Thank you all so much for coming. We are beyond excited for the next 2 days. We've got an excellent lineup of speakers and presenters. We hope to have great discussion with everyone in attendance, and so thank you so much for coming. Before we get started, I've got just a couple housekeeping issues. First of all, I want to say a big thank you to our sponsors. So Children's Mercy Hospital, weighing in, Department of Health and Human Services, Health Resources and Services Administration, and the Office of the Assistant Secretary for Health. And I want to specifically mention a few individuals. So the first would be Richard Overcast of HRSA. Rich is back manning all the AV today. And Ray Hutchinson, I'm not sure where Ray is. They have been our HRSA contacts and liaisons, and they have done a mountain worth of work to get this conference organized. So big thank you to them. I also want to thank the Weighing In team for all their work on this project. So Shelley Summer, if you want to wave, Shelley, Emily DeWitt, I think she's out front, and Emily Meisen-Sebelius is hiding in the back behind a column. Again, they have done an incredible amount of work to get this conference to where it is. So thank you very much. So we have worked really hard to make this a health-focused conference, and I have to admit, some of this we thought of ourselves, but much of it came at the prodding of our keynote speakers, who I'll introduce in just a couple minutes. But they mentioned, great, your agenda looks great, but this is a conference about preventing and treating childhood obesity, and you've got people sitting all day long. And that is not right. And so part of our efforts to make this a health-focused conference is to several things. First one is after a speaker is done presenting, no matter how good or poor their presentation was, we ask that you give them all a standing ovation, okay? So let's go ahead and practice right now. Standing ovation, yes, thank you, thank you, thank you, thank you. Also, you are welcome to stand at any point during any of the presentations. Just be, of course, respectful to your neighbors, but there are several spots around the room. There's a charging table off to the side that you can stand at. Please stand as you feel needed. We have also made the decision to have as many healthy food items as possible during the 2-day summit. And so that means that we've requested fruit and vegetables during the AM snacks. We've replaced our afternoon snacks that normally are sweets with things like granola bars and snack mix. We have added baked chips and pretzels to the lunch options, and we have no sugary drinks. And so these are things that these two items are things that anyone can do as you're organizing your own meetings, whether they're large or small. You can make the choice for healthy items and not restricting physical activity and promoting physical activity throughout any meeting that you host. So we hope you take that lesson home with you. We also have privacy rooms available for mothers, and if you have, if you are a new mother, you can talk to either one of the organizers or the Kaufman staff, and we'll point you to those privacy rooms. There are restrooms. They're just down this hallway if you haven't found them already. And the last thing is there are excellent places to get a little bit of physical activity throughout the day, just right around the Kaufman Center. And we've placed walking maps, a few different walking maps, in your packets for you to use. And so here you can see where we're at right now. We're right there, the Kaufman Foundation. As you can see, all this green is beautiful, park-like environment. There are lots of trails around here. The first one, just if you walk around the pond, which I like to run around actually, is about 0.6 miles. So that may take you 10 minutes or so. If you want to do something a little longer, you can head across the way to Tice Park, which is right by the beautiful conservatory here. That loop is about 0.75 miles. If you're feeling like you really want to stretch your legs, you can go up and walk up the steps of our beautiful art museum. Round trip, that's about 1.3 miles. And of course, this is Kansas City, so Jack Stack is 0.8 miles from here. So, other conference information. All of our speaker bio and agenda can be found on our website, which is kind of a long website, but 2018 Region 7 Childhood Obesity Summit.com. There's also going to be information where you can watch recorded versions of all of these presentations online. You can go to that website and find out more information. There's a special invitation for Missouri and Kansas attendees. Children's Mercy, and specifically the Community Benefit Program at Children's Mercy, is one of our sponsors, and so we thank them for their support. They are soon planning their community benefit survey, and so we would like to invite all the organizations in Clay, Jackson, Johnson, and Wyandotte County to bring your lunch today into the Brush Creek Room, which is just down the hallway, to participate in a planning session for the 2019 Community Health Assessment. As you may be aware, every 3 years, Children's Mercy conducts an assessment on children's health across the region, and we need your input in planning the next assessment. And one lucky participant will actually get $25 gift charge to PB&J restaurant. So we'll give you more information at lunchtime about that, but keep that on your radar if that applies to you. We've got a great lineup of speakers, and the cornerstone of that lineup is our 2 keynote speakers. The first one, the speaker that will headline tomorrow's session is Dr. Bill Cole, and we'll give you more information on Dr. Cole tomorrow, but just briefly, he's a professor in epidemiology, human genetics, and environmental sciences at the University of Texas, Austin. He was the lead epidemiologist and team leader in the physical activity and health branch of the Division of Nutrition and Physical Activity at the Centers for Disease Control and Prevention in Atlanta. In 2006, he participated in one of the really milestones in terms of physical activity and public health, and that's the creation of the first U.S. guidelines for physical activity. They were published in 2008. He was the leader for that, and he was the founder of the International Society for Physical Activity and Health. And so he'll be leading off tomorrow's session. We're also going to put him to work at the end of the day today to help us kind of summarize today's plans. But make sure you're in attendance tomorrow for his talk bright and early. Our other keynote speaker, and we'll talk a little bit, I'll give you a longer introduction for Dr. Salas, but Dr. Jim Salas, and he'll give our keynote in about 15 minutes today. Before we get to Dr. Salas, though, I wanted to introduce 3 key individuals that have been really instrumental in making this conference happen. And the first one is Lisa Goschen. She's the Regional Administrator for the Health Resources and Services Administration. She is the regional administrator. This region covers Iowa, Kansas, Nebraska, and Missouri. The office provides on-the-ground outreach, education, and technical assistance, and partners with local, state, and federal organizations regarding HRSA programs. Lisa has worked with the Department of Health and Human Services for 20 years, and she's a Mizzou alum where she got her Master's of Science in nursing from there. So I'd like to welcome Lisa to give a couple remarks.
Well, good morning. I'm really excited to help kick off the summit today. So thank you for attending the Heartland Childhood Obesity Summit to talk about factors of health and addressing the systems influencing childhood obesity. This summit has been a collaboration between my office, the Health Resources and Services Administration, the HHS Office of the Assistant Secretary for Health, and Children's Mercy, and we're all based here in Kansas City. So I'd like to say thank you to all of our partners for all the hard work getting this event together. It's really been a collaborative effort, and we've really been fortunate to work with such great partners. And also I'd like to say thanks to the Kauffman Foundation Conference Center for an awesome place to have a conference. So obesity is a long recognized and fast-growing public health issue in the United States. It's got serious health and economic consequences, and reversing the trend is really a national priority. This summit was designed to bring together stakeholders from diverse sectors to share knowledge about the factors of health, such as social and economic factors, physical environment, health behaviors, and health care, all of those things that influence childhood obesity. So over the next couple of days, we'll be amplifying regional evidence-based practices. We'll look at community-based efforts, and we'll look at policy strategies that address these factors of health in an effort to promote and sustain healthy lifestyles for our region's children. For the Health Resources and Services Administration, reducing childhood obesity is a very high priority for our agency. HRSA supports more than 90 programs that provide health care to people who are either geographically isolated in rural areas, economically vulnerable, or medically vulnerable. And we do that through a variety of grants to more than 3,000 awardees, and those grants go to a whole variety of organizations. But one important thing is that we have HRSA-supported health centers that provide primary health care on a sliding fee scale to people, regardless of their ability to pay. Right now, there are 1,400 health centers across the country, and they're operating more than 11,000 sites across the country where they're providing health care. They help patients manage diabetes, high blood pressure, and other diseases and conditions that are associated with overweight. And HRSA partners with the National Institute of Health to use NIH's We Can program in those health centers to help prevent obesity in youth from ages 8 to 13. We also support a lot of rural programs, and so we have some rural healthcare services outreach grantees who have done innovative strategies to address obesity in rural areas, including family education, fitness programs, clinical interventions, and they've done social marketing campaigns focusing on preventing childhood obesity. And then HRSA also funds the Maternal and Child Health Block Grants. These are funds that go to states and territories to improve the health of mothers and children and their families. Right now that we know that more than half of the states in the United States have identified reducing obesity and overweight as a high priority for them. And so for HRSA, one of the performance measures that we use for these grants is we look at the percentage of children aged 2 to 5 years who are receiving WIC and who are also have a body mass index above the 85th percentile. So we've incorporated reducing childhood obesity into some of our performance measures for the states. HRSA also supports Bright Futures, which is a national health promotion and disease prevention initiative, and it addresses children's health needs, but very holistically in the context of their family and community. So this is a tool that healthcare providers and parents and policymakers can use to some guidelines to help them improve the health of children. So if you'd like any more information about our agency, you can feel free to talk to any of us today. Please look at our website, hrsa.gov. And once again, thank you for joining us. We're really excited to talk about the factors of health and addressing the systems that are influencing childhood obesity. So thank you.